Good afternoon. I'm so humbled and excited to be here with you all. As you can tell, this is my first U.S. Conference of Mayors event, just a year into the office. And so I want to thank Tom and the entire team and everyone who's been involved in putting this together. And thank you to you all. I want to tell you a little bit about an issue that we've been working on in Boston and where we see some signs of hope and possibility. I want to put out a personal ask for some advice as well. But first I want to tell you what the speech is not about. I know the title is Embracing the Possibility. I'm not here to talk about our new beautiful memorial that I know everyone has had some opinions on. Everyone's an art critic these days, but we love it in Boston, and it's been such a symbol of the chance for community to really hook arms, link arms, and stand together in the fight for racial justice that continues to this day. So we're very proud of the embrace and all that has gone into that. So my personal ask, I'm a year and 2 months in now, and next Thursday is my very first State of the City address. I am terrified, and please come up to me afterwards and share your best ideas of how to do this. How do you possibly tell the story of all the experiences that you've had in a year? The potholes, the fires, the late night events, the early morning ride-alongs. How do you possibly thank properly an entire city workforce that has put so much on the line through a pandemic? How do you avoid having words and gestures turned into a meme on social media afterwards? Lots of things that I want to learn from you all. We are, after all, operating in a larger moment at the local level all across the country of being in a nation divided right now. And that plays out in all different ways, and how, as a society, we're trying to figure out how to connect, how to build community. What is the truth? How do we cut through the noise to get to that? And whether and why to bother with this thing we have called democracy. Mayors have always been at the front lines of that messy, beautiful conflict of democracy, and now more than ever, we are truly at the front lines of all the many ways in which the pandemic continues to impact our residents. In Boston, there is no clearer embodiment of decades of social structures being dismantled, the need for federal or state resources that have taken some time getting here, the pressures of the housing market, the trauma that has gone untreated in communities. No greater embodiment of that than an area of our city known as Mass and Cass. Mass Ave and Melnia Cass Boulevard is where the intersection of homelessness, our opioid crisis, and our mental health crisis are every single day. When I came into office, we, in this area of the city, had more than 200 people living on the streets, some for many years at that point, in nearly as many tents, fortified into encampments. Daily fires that the fire department was going out to try to address because of the propane tanks to keep people warm. Diseases and communicable illnesses spreading through, carried by rodents because of the unsanitary conditions that everybody was living in. Violence, incidents of public safety that were spreading far beyond into throughout the city because of the need that was untreated there. And this had been going on for many years at this point. And in years past, there had been efforts to clear tents, and of course, they came back and people came back. And so we made a decision early on that the problem here wasn't tents. The real challenge, what we needed to support and empower, is not removing tents, but building up people. And in just about now, a year ago, we had launched a 2-month effort to ensure that we were speaking with every single resident living in our encampments, understanding the needs, mental, physical, health-wise, on the recovery spectrum, and created an individualized plan for every single one of our residents living there at that moment, added 200 low-threshold housing units, and on a single day, January 12th of last year, coordinated the move so that everyone's property and belongings were carefully secured, transition and free transportation to their new low-threshold housing with wraparound medical supports and services, and each of those 200 tents taken down because they were no longer necessary. Now, I said then to our residents, and I say again today, we did not solve homelessness on January 12th of 2022. We made a big effort, and we made a big step forward in terms of addressing the humanitarian crisis of people living on the streets in encampments. And 2 weeks after January 12th, we had one of the biggest blizzards ever in Boston's history in January, and I was just thanking everyone involved, and particularly those who had divine intervention, that the timing was such that we were able to save so many lives in that way as well. But I want to tell you about what's happened in the years since then, because certainly we have much, much work left to do. When we began, there were almost 200 people on that first wait list for housing, and we were able to create the housing that was able to meet people's needs. 24-hour medical services available, connection to recovery treatment. Compared to individuals who have been seeking services on the ground without low-threshold housing and supportive housing provided, that experience of living in a tent and still trying to get to a medical appointment, figure out what day it's on, figure out the transportation to get there, make it there on time, is near impossible. But for our residents living in these housing units, at any given time, we had about 90% working with a housing navigator, 85% with a housing plan in place, 60% with a housing resource in hand. They had a rent subsidy or a way to pay for housing and just waiting for that next opening in a permanent housing or an apartment to come by. 2/3 receiving regular primary care treatment, 50% receiving medication for substance use, a third on top of that receiving non-medicated treatment for substance use, a third receiving mental health services. Again, compared to the likelihood of being able to make it to appointments consistently living on the street, this has been transformational. Now, nearly 50% of the people in that original wave in our housing surge have moved all the way through transitional housing to a permanent home because they've been able to hold down a job and are able to pay rent because of the supports and services. And as people have moved on to that next step, their spots have opened up. Of course, more people have come. The need continues to grow, and more spots have been filled. We have served now more than 430 people through our phases of this housing and support spectrum. Now, we can't do this without continued resources, and often that comes from state and federal partnership. And that comes from cities standing up together to say, we know what works. We know that this is about people and not tents. This is about services and not just syringes. And so I'm asking all of you to lean in with us. We have a lot more learning to do in Boston, and I would love your best ideas, practices, data, research to really figure out how we can make this a sustainable effort. Our city is able to serve about 200 people at a time, and then we add to our wait list, and it grows. As the housing market federally, as the economy goes in a difficult direction and the continued pressures that our families are feeling all come out of the city level, it is on our shoulders to think creatively and to really embrace what's possible. We in Boston have found that doing so means recognizing that when challenges are interconnected and intersectional, in fact, you can't tackle them one at a time effectively. You have to do it all at once and in a way that provides that wraparound recognition of the wholeness of people's lives. So I'm looking forward to learning a lot more from you all. Thank you so much for being part of this, and I'm really excited and looking forward to your mentorship. Have a great day, everyone.